Why isn't neuromodulators such as Botox lasting as long on some patients? I'm Dr. Melanie Palm. I'm board-certified dermatologist, fellowship-trained cosmetic surgeon, and clinical investigator to over 60 FDA trials. And I'm going to answer that question. So we'll use Botox generally because all of the neuromodulators can actually lose efficacy rarely, and it doesn't happen very often. So I think it's a curiosity that out in social media world, so many people are saying that their toxins are not working. What this usually is attributed to, if it rarely occurs, is small doses of toxin over time being administered too frequently. So we are presenting that protein to our body, and our body is incredibly smart. And for very rare individuals, we develop something called neutralizing antibodies. It's very rare for this to happen, but we want to avoid frequent and low doses of neuromodulators such as Botox. Putting this rare case of neutralizing antibodies aside, there are other things that contribute to a toxin such as Botox not working. Number one, there are muscle groups that we treat lightly, such as the frontalis, the forehead muscle. In order to get natural results and not drop the brows, we often do fewer units, and we know that there is a dose-duration relationship between how much we do and how long it lasts. If you're treating some big muscle groups lightly, you're going to see action coming back a little sooner. I also think some practitioners dose per area, so you don't know exactly how many units are being administered. If it's done very lightly, the result is not going to last very long. What do we do in that instance where we don't know how many units or it's light? You may want to increase the units. So you should be asking your provider exactly how many units you're doing. They should be able to give you a facial map of where they're actually injecting things. If you are the rare patient that has gotten small doses too frequently over decades and you start to develop neutralizing antibodies, the only real antidote is to actually stop cold turkey. So you do not treat with a toxin for a year and then we retreat.